Antibiotics are one of the most significant medical discoveries of the 20th century, revolutionizing the treatment of bacterial infections. The discovery of antibiotics dates back to 1928 when Scottish scientist Alexander Fleming accidentally discovered penicillin. While working with bacteria in his lab, he noticed that a mold called Penicillium had contaminated one of his petri dishes and was killing the surrounding bacteria. This discovery led to the development of the first true antibiotic, penicillin, which was later mass-produced in the 1940s, playing a pivotal role in treating infections during World War II. Following penicillin's success, other antibiotics were discovered, marking the beginning of the antibiotic era. Antibiotics can be classified based on their mechanism of action, meaning how they attack bacteria. Broadly, there are 5 main categories. Cell wall synthesis inhibitors. These antibiotics, such as penicillins and cephalosporins, target the bacterial cell wall, which is essential for the bacteria's survival. By inhibiting cell wall formation, they cause the bacteria to burst and die. Protein synthesis inhibitors. Antibiotics like tetracyclines and macrolides interfere with bacterial ribosomes, which are responsible for making proteins. Without protein synthesis, the bacteria can't grow or reproduce. Nucleic acid synthesis inhibitors. These antibiotics, such as quinolones and rifampin, block the replication of bacterial DNA, preventing the bacteria from multiplying. Folate synthesis inhibitors. Antibiotics like sulfonamides inhibit the production of folic acid, a vitamin necessary for bacterial growth. Cell membrane disruptors. Polymyxins are a type of antibiotic that target the bacterial cell membrane, causing it to leak and eventually killing the cell. Antibiotics are also classified by their spectrum of activity, which refers to the range of bacteria they can target. Broad-spectrum antibiotics. These drugs, like amoxicillin or tetracycline, are effective against a wide range of bacteria, including both gram-positive and gram-negative types. They are useful when the specific bacteria causing an infection is unknown, but they also pose a higher risk of antibiotic resistance. Narrow-spectrum antibiotics. In contrast, narrow-spectrum antibiotics like penicillin or clindamycin target specific types of bacteria. These are ideal for treating infections when the bacterial cause is known, as they are less likely to affect beneficial bacteria in the body. Antibiotics can also be classified by their chemical structure, which is important because antibiotics within the same chemical family often share similar properties and mechanisms. Some common classes include beta-lactams. This group includes penicillins, cephalosporins, and carbapenems. They work by inhibiting bacterial cell wall synthesis. Macrolides. Antibiotics like erythromycin and azithromycin fall into this category and are known for their ability to treat respiratory infections by inhibiting protein synthesis. Tetracyclines. These antibiotics, like doxycycline, are broad-spectrum drugs that block bacterial protein synthesis. Aminoglycosides. This class, which includes gentamicin and streptomycin, is potent and used for severe infections, often in hospital settings. The discovery and development of antibiotics have saved millions of lives, transforming modern medicine. While antibiotics are powerful tools for fighting bacterial infections, their overuse and misuse have led to the rise of antibiotic-resistant bacteria, a global health challenge today. It's important to use antibiotics responsibly and only when prescribed by a healthcare provider to preserve their effectiveness for future generations.
Thanks for your time and support. Stay connected with me to learn more interesting pharmacological studies. Must ask any question or confusion in comment box. Let me know which medicine information you want next. Thank you.